What causes sudden infant death syndrome? Sudden infant death syndrome is the unexplained death usually during sleep of a healthy baby less than a year old. It's also known as cot death. It is not known what causes sudden infant death syndrome, but it has been noted that there are defects in the part of an infant brain that controls breathing and arousal from sleep. Causes: there are physical and sleep environmental factors that can make an infant more vulnerable to sudden infant death syndrome. These factors vary from infant to infant. Physical factors: brain defects. There are infants born with the part of the brain that controls breathing and arousal from sleep that has not matured enough to function properly. Low birth weight. Infants born prematurely or who are part of a multiple birth increases the chances of unmatured brain. This infant has less control over automatic processes like breathing and heart rate. Respiratory infection. Many infants who die from sudden infant death syndrome have had cold recently, which might contribute to breathing problems. Sleep environmental factors. Sleeping on the stomach or side. A baby placed in these positions to sleep might have more difficulty breathing than those placed on their backs. Sleeping on a soft surface. Lying face down on a fluffy comforter, a soft mattress or a water bed can block an infant's airway. Sharing a bed. There is a higher risk of sudden infant death syndrome when the baby sleeps in the same bed with parents, siblings or pets. Overheating. Being too warm for the infant while sleeping can increase the risk of sudden infant death syndrome. Risk factors. Low birth weight and premature birth increases the chance of sudden infant death syndrome. Boys are slightly more likely to die of sudden infant death syndrome. Infants are most vulnerable between months 2 to 4 of their life. Babies who live in an environment with smokers are at a higher risk of sudden infant death syndrome. Maternal risk factors. When pregnant, the mother also affects her baby's risk of sudden infant death syndrome if she is younger than 20, is a smoker, uses alcohol and drugs, doesn't get adequate prenatal care. Prevention. You can reduce the chances of sudden infant death syndrome by following these tips. Place your baby to sleep on its back rather than on the stomach or side every time you put the baby to sleep for the first year of its life. Use a firm mattress and avoid placing the baby on thick, fluffy padding. Don't leave pillows, toys or stuffed animals in the cot. Don't overheat your baby. Don't cover your baby's head. Your baby should sleep in your room with you but alone in its cot for at least 6 months and if possible up to a year. Breastfeed your baby for at least 6 months. This lowers the risk of sudden infant death syndrome.